I'm Chirata lecturer, and today we'll be discussing something about basics of diagnosis of CNS TB or TB meningitis. Now, before I begin, I would like to request you to like, share, and subscribe to the channel if you haven't already, and download our app. Visit our beautiful website. And if you are seriously planning to, learn pediatrics, be it you are a PG, be it you are a neetpg aspirant, then please make sure you check out our awesome courses. All the links are in description below. Okay, so the CNS TB is the most common. CNS TB or TB meningitis, TBME, is the most severe and the dangerous complication of tuberculosis, and it is the most common cause of mortality in pediatric patients with TB. Okay, so how will you, the diagnosis of TBME? How will you diagnose TBME? So actually we use the BMRC criteria, British Medical Research Council criteria for the staging of TB meningitis. So it is ideally divided into 3 stages: stage 1, stage 2, and stage 3. This is just in brief. I am not going into the detail, but the stage 1 are non-specific clinical features like weight loss, myalgia, weakness. Then the stage 2 are the meningeal features, where the features of meningitis are positive. Meningeal features include vomiting, loss of consciousness, seizures. All that meningeal clinical features are seen in the stage 2, and in stage 3 you see posturing and the complications. There is posturing, there is coma. All the clinical features of complications stage 3 are there might be increased ICP. Okay, so all these clinical features are seen in stage 3. So this is the BMRC criteria. But when to suspect the diagnostic algorithm of TB meningoencephalitis, TBME. So the diagnostic criteria of TBME is that if patient has clinical features that are suggestive of TBME, like the 3 stages that we talked about, you have to investigate the patient. Okay, so the first thing you have to send are the 2 investigations. One is the ZN stain of CSF and CSF CBNet. Okay, if any one of them is positive, then the diagnosis is TBME. Okay, but if it is negative, if the ZN stain CSF CBNet is negative, then you have to diagnose it with presence of more than or equal to 2 criteria out of 3. Okay, if more than or equal to 2 criteria out of total 3 criteria that I'm writing over here is positive, then you can say that it is TBME. So A, B, and C. So in A criteria, it is the clinical features plus lab criteria. The criteria 2 is criteria of risk factors, and criteria 3 is presence of TB in the body. Okay, so there are these 3 criteria. Out of them, if 2 or more are positive, then you can diagnose or label it as TB meningitis. Now for the criteria A to be positive, for the criteria first, the clinical features plus lab, this criteria is positive if more than or equal to 4 out of 6 of the following sub-criterion is fulfilled. Following sub-criteria is fulfilled. So which are the 6 sub-criteria? Okay, 1, 2, 3, 4, 5, and 6. So first one is more than or equal to 6 days of clinical features. Okay, WBC in serum. Okay, blood WBC is less than 15,000. Okay, the WBC should be less than 15,000, not more than 15,000. Then the third criteria is CSF WBC. CSF WBC should be 10 to 300 per millimeter cube. Then the next criteria is CSF lymphocytes. Lymphocytes should be more than 50% of WBC. Okay, majority of the cells that are in the CSF should be lymphocytes, plus the CSF glucose. CSF glucose should be less than 50% of plasma glucose. Ideally, it is around 2/3 of plasma glucose. Here, it should be less than 50% of plasma glucose. And the 6th criteria is imaging suggestive of TB. Now, what are the findings in imaging that is suggestive of TB? So, hydrocephalus, basal exudates, okay, and tuberculomas. and gliosis and infarcts in brain. Gliosis and infarcts. Okay, so out of them, any 4 sub-criteria is positive, then you can say criteria A is positive. Now, in risk factor criteria, there should be more than or equal to 2 risk factors should be present. So, out of this 3 risk factors, any 2 should be positive there. So, first one is HIV positivity, second is malnourished patient, SAM positivity, and third is TB contact. If any 2 of them is positive, then you can say that the criteria 2 is positive. And the third criteria, TB positive, is, it is something like if there is anywhere else TB is positive, like may it be TB lymphadenitis, may it be pulmonary TB. So TB should be present anywhere. The diagnostic, the other TB should be diagnosed from before. So this is how you need to go for. Now, if the criteria is not fulfilled, then give antibiotics. If this criteria is negative, positive hai, so then you have to give AKT. If it is negative, then antibiotics should be given. Antibiotics should be given to the patient. See, meningitis treatment, you give cefotaxime, you give vancomycin, Miro, depending upon the patient. And once you have given this, you have to give antibiotics for 48 to 72 hours and review the patient. Review after 48 to 72 hours all this criteria. If it is again negative, then you should put up an alternate diagnosis, and if it has a very high likelihood of being TB positivity, then you have to go for the diagnosis of TB anyway. Now, how do you differentiate tuberculoma from neurocysticercosis? So when you go for NCCT, in tuberculoma, you have more than 2 centimeter lesion. It is more than 2 centimeter lesion, which is irregular in shape, and perilesional edema is there. On the other hand, the NCC is less than or equal to 2 centimeter with a thin round border with variable edema. It is not extensive, it is variable edema. Okay. The most common location of tuberculoma is either infratentorial or supratentorial. Both can be seen. While NCCT, it is only supratentorial usually. Okay. And midline shift is present. with TB. The tuberculoma midline shift is present, while it is usually negative with NCC. Okay. Now, when you go for MRI, the T2 imaging will show hypointense score. Hypointense score is seen in tuberculoma, while in the patient with NCC, you can see the Scolex. It is a hyperintense score. And if you go for MR spectroscopy, then there is a lipid peak in tuberculous meningoencephalitis, which is not there in NCC. So usually, this is the diagnostic algorithm of tuberculous meningitis. This was a brief lecture. The entire lecture on tuberculous meningitis is available on the app. So I would like to request you to see that lecture. That's all for today, guys. I hope you like the video, and I will see you in the next one.